y todos los que nos están escuchando hoy. Tenemos un programa muy informante sobre la respuesta de Nevada ante el coronavirus y la comunidad latina con nuestra asambleísta Selena Torres. Hola, ¿cómo estás?
Estoy muy bien. ¿Y cómo estás tú?
Pues bien, aquí hemos estado en casa, preveniendo el contagio del coronavirus. Nosotros hemos experimentado muchos cambios de la vida, pero todos por una buena causa. Thank you so much for being here with us today, Assemblywoman Torres. I think we have a lot of information that we need to share with the Latino community. And I just want to note that we're focusing today on Nevada and the Latino community because we have some, cultural differences that play a large role in how we're managing or how we can manage the coronavirus and COVID-19. So, and I think one of the biggest things that we can do right now is share with people information that's trusted. And so that's where you come in. And I want to thank you so much for coming here and doing this live with us today and being a part of helping us save lives.
Well, thank you so much for having me, and thank you for the role that you have in making sure that we share information for our community that's easily accessible.
Yeah, so I just want to start off saying I'm wearing a red ribbon today, and this is in honor of healthcare workers. So we want to give a big thank you to everyone right now who's on the front lines, healthcare workers, and also other people who are helping to stop the spread and to keep our lives going. At the grocery store, the truck drivers, people who are cleaning and making sure that we have healthy environments. And everyone else who is really exposing themselves on a day-to-day basis, we want to keep them as healthy as possible. Can you give us a background about what's happening in Nevada with coronavirus? How is the state doing?
So right now in Nevada, we have over 2,000 cases that have been people that have tested positive, although we are sure throughout the state that there are more people that maybe have not had the opportunity to be tested yet, or individuals that are currently not showing any symptoms. So they might be positive, but they don't have the symptoms yet. So they haven't been tested. And I know that we are watching it get progressively increasingly worse, and it's more scary and becoming, I think, more real for a lot of communities here in Nevada. However, we're very fortunate to have a governor that's taking the necessary precautions and started pretty early on in this virus, as far how it was in Nevada. He started making decisions early on to prepare us for this point. So I think that, with strong leadership and with good decisions, we'll be able to prevent some of the casualties that we otherwise would have experienced.
Yeah, it's really, I'm really proud of people who are staying home as much as possible. What have you been doing at home? How have you seen your work life change? I know that I live with my aunt and uncle in a Latino household. It's a very Latino household. And so we're keeping ourselves entertained, but I know that it's very hard for them to not go out and not to see family too.
Yeah, I know for my family, it's been very difficult just not being able to really leave the home. I live with my brother, and I think for both of us, just not working as much as we're used to, not having the opportunity to socialize with as many people as we usually do, has been difficult for us as young people and as young professionals. Both of us are educators, and so we are still engaging with our students, but it's still not the same as being in a classroom. So I definitely miss my kids. It's also hard to have the same schedule. I'm sure this is something you're experiencing as well. This idea of getting up early and getting to work. It's really hard when you're at home and you're staying at home all day. I try to leave the house once a day to just go for a run in the neighborhood, and that helps me. But it's definitely difficult to just be in my small home all day long.
Yeah, and I see that. I think one of the main points that I want to bring to the surface and reiterate a lot is that we have really large families as Latinos, and We're trying our best to stay home, and that also means to not have over some of our relatives who we consider part of our really close family. We don't see them as extended family. They're like considered to us as what other people would consider nuclear family members as well. But just want to stress how much the stay-at-home policy means. Stay at home, don't invite over your cousins, your primos, or your tios. Like some of those birthdays just have to wait until another moment, and follow all of the precautions and the advisories that the state and local governments are issuing right now. Assemblywoman Torres, what is Nevada doing in response to the coronavirus? I know that there's a task force that has been started. Can you tell us a little bit about that and what your role is with that?
Yeah, the Nevada Hispanic Legislative Caucus, of which I'm a member of, formed the COVID-19 task force for two reasons. One, to assist the governor's office in providing recommendations of where we see that there are needs for our community. And two, to help provide messaging for the Latino community and the immigrant community about some of the things that we know that our community is reaching out and needs. I think a lot of the information that we push out in the government and in the legislature as a whole is oftentimes not easily accessible to the general public. So how do we make this like very complicated legal directives and get it so that it's in a way that is user-friendly and easily accessible, and that allows me to know who to call if I still am having an issue. So, for example, our governor recently issued a statement on a moratorium for evictions. And so it was important that we had information that was easily accessible about what an eviction meant and who this included, but also what to do if you were a victim of having an eviction in this time period. So it was really important to us to make sure that the information was easily accessible for our community.
What are some of the top concerns that you're seeing that this task force is really tackling? What are, I know Latinos work in certain industries that are being hit hard right now all across the nation, especially where we have large populations of Latinos like in Nevada as well. Can you speak to some of those concerns? And if you have any information that we can relay to people right now, feel free to share some of that too.
One of the big ones that I know that we're getting a lot of messages about is just where do we access food banks? How do we access them? And who is able to access a food bank? One of the things that I think in our community it's important to share is that you're not required to bring your social security number to a food bank. Anybody can access a food bank, regardless of where they come from or their language that they speak. And so it's important that we get this information out because we have a lot of people that have been hit hard by this crisis and that are currently food insecure. The other thing that we get a lot of questions about is just how to access the unemployment website and how to use it. And so we try to provide direction of where to go to access this information. A lot of people just simply don't know where they need to click or what they have to do. And I know that the unemployment website is frustrating for us all, but we try to provide the assistance that we can so it's not as difficult for our families.
Okay, and so this site where Latinos can go and get some information is Ayuda Nevada. Let's see, what is it? AyudaNevada.com?
Yes, that's correct.
Okay, I'm going to share that right now with everyone on this rolling screen below. I'll have AyudaNevada.com. And so information on useful items like food bank information, unemployment. Are we sharing also some like precautions that people should be taking?
Yeah, definitely. And also just like information about emergency directives that may occurred. So what this means for Nevada, where to access community health clinics that serve everybody without exception. That's on there. And we try to make the information as easily accessible as possible. But we also know that it's a lot of information. So if you can't find the information and you're using the website, there's like a little chat box on the bottom right-hand side of the screen. And you can just put your message in there, put your contact name and phone number, and we get back to everybody so that they feel that they have support and they know where to go if they have questions.
And so what is your role within this task force? How are you supporting the coronavirus task force in Nevada? We want to hear because you're young, you've been doing a lot of work on this and all of it has been critical. The pandemic is new to everyone right now. And so there's been a lot of work undertaken that's a novelty for all involved.
So I'm the chair of the COVID-19 task force. So I'm really helping directing just where we're putting our efforts and what we're investing our time into right now. But I really am joined by a phenomenal team. I'm joined with Dr. Karina, which has been a real asset for me to understand the medical side of things and how this impacts our community. Mi familia vota, my vice chair is Cecilia Alvarado, and she's been a phenomenal resource for me as well. So we have a number of community groups and organizations that are participating in this as well from different backgrounds. So we have different nonprofits and organizations, but then we also have individuals that are what I would consider experts in their field that are able to provide that insight of how this is impacting their communities. So we're really have a diverse group of voices that can come together, and I think that they've come up with some phenomenal ideas. Right now, we're working on creating a food pantry system for individuals that have been hit by the COVID-19 virus and that are currently unable to leave their home so that they don't have to leave their home. So it's about finding resource, but then also connecting our community with the resources that are available.
That's so great. So we're seeing a lot for our Latinos of unemployment issues coming up as well. Can you give us some tips on what to do if our employers can no longer employ us because of what's happening with coronavirus?
Yes, if we know that we're impacted by coronavirus, we need, because we're being laid off of our job, we're being furloughed, we're being let go, immediately we should be creating our account so that we can file for unemployment. And creating your account is actually something you can do before you file, and making sure you save your username and password. I think one of the biggest barriers for a lot of members of our community is that they've created an account and now they forgot their username and password. This is a big roadblock for them because it's hard to get a hold of the office, and maybe they don't have the link where they can go to access and reset it. And although the governor's office has already issued it so you can do it all online, it still can delay your process. So it's best to just create your account, know that you have an account set up, know your username, know your password. Don't make it more difficult than it needs to be. Write it down, save it somewhere so that you can easily access it. We have here in Nevada 24-hour lines too, so you can contact them at any time. And I know people are having a rough time getting through on the phones, so making sure you're careful when you're filling out your unemployment is super important. Because if you do it wrong, it's not going to be accepted, and then you're going to have to call, and you're more likely to have an issue. So make sure you really do it carefully. Look at the name of your employer. Sometimes you work for a company, but that's not the person that's paying you, right? Sometimes you work for a company, but the corporation is what pays you. So you need to write down the corporation's name instead of the company. And if you don't know, ask your HR. Ask somebody else that works for the company that you know has already been approved for unemployment, because you don't want to run the risk of delaying your own payment.
That's such a great tip, and I think that that's so important for everyone. Like you said, there's a surge in unemployment across the nation right now, and so capacity at unemployment offices is going to be very limited, and so people should take that into account. If the capacity is limited, if there's a problem with your application, it's going to be very hard to get through for some assistance to make that correction. So thank you so much. That's a great point. Make sure that you have someone who's already been approved and who's gone through the process to help you out if they work with you, so that there are no errors.
And then file your weekly claim every Sunday. Don't forget, because if you forget about it, then you might run into issues with you not getting your unemployment money. So every single Sunday, log in and just do your weekly claim. Do it every Sunday or Monday. Do it, because it takes a few days after that for you to even get the money deposited into your unemployment card.
And I would even say to people, put a note on your phone, put a note on somewhere, establish a time for you to file your unemployment on a weekly basis so that at this time so you don't miss it. I think that's really important right now. And like you said, there could be problems down the road, or people may not be able to access their money if they miss an unemployment date.
Yeah.
It can be really detrimental to the rest of your filing. So I'm looking at the Ayuda Nevada page right now. Again, for anyone who's watching, ayudanevada.com, and they have right now some community tips and for a number of issues, including food banks. We also have issues on how to stay healthy, and then we have a video also on housing in Nevada. What does the housing situation look like, people, especially for our Latino community in Nevada right now?
You know, right now is a really difficult time for a lot of families because they're having a hard time making ends meet, and they know that they're not able to. They know that they're not going to be able to make this upcoming month's rent because of the current situation. And so, what's really important, I think, is that families are proactive. So, something that our legal aid is really encouraging people to do here in Nevada is make sure that you have the money for rent set aside and pay it as soon as possible. Like that should be your first bill. When you're looking at the bills that you need to pay, rent should be the first. Even with the waiver, the moratorium on evictions, you know you're gonna have to pay it when the state of emergency is over. And we don't want families to run the risk of accumulating 3 or 4 months of rent that is late, and then now having to pay it all at once. So whatever you can put aside and save it and pay off the months that you can, little by little, so that we aren't running the risk of being evicted at a later date. Additionally, if you are having trouble, or if you are currently in a situation where you're living from house to house, couch to couch, reach out to us and we'll try to connect you with shelters where you might be able to stay. We know that times are tough, and we're trying to form relationships with a lot of community partners. Additionally, it's important to note that the United Way of Nevada was approved for $2 million from the IFC, which is our finance committee, during the interim, and they approved $2 million to go to United Way, and a good amount of that money is going to be used for rent assistance. And so it's important that you know that the state of Nevada is acting quickly and swiftly to ensure that we have funds in places for our community to get rent assistance. As soon as we have more information about what that's going to look like for Nevadans, we will be sending that information out to our community and having it posted on our site as well.
Yeah, and it's so critical for people who are in desperate need. We understand that right now is a very, very stressful time, and that people may not have their housing. They may not have had their housing situation set for this. Now it's more difficult now that we have we're in the middle of the pandemic. But it's critical to reach out to local resources, to try to find one space for you to be in and to live in one spot right now, because movement could facilitate other people contracting coronavirus or the spread. So we want to make sure that people are as limited in their movement as possible right now, just to contain the spread of the coronavirus.
And if you're a tenant too, and if your landlord is posting things on your door saying that you need to be evicted, if you have been respectful to your property and not destroying your property, that would be the only exception. If you've been a good tenant, even if you've been late in other months, you have the right to stay in your property right now. There should be no reason that you're evicted from any property, whether it be a standard apartment or if it's a weekly apartment. Regardless, you should not be evicted at this point. And if you think that you are going to be evicted, or if they're posting notices, or if they're coming into your apartment every single day threatening you, you need to reach out to us, because we're more than happy to connect you with resources here in town where we are going to help you, because no person should be living in the fear that they're going to be evicted right now.
That's great. And for people who have health issues right now, are you the Nevada is also setting up? Do they have community clinics that they can go out to? What would you say to people with any sort of outstanding health needs, or who need to see a clinic, or who are fearful that they may even have the coronavirus themselves?
So if you think that you have the coronavirus, one of the most important things is really to stay home. Do not go out. Do not leave to go to the store. Don't go to the emergency room. Don't go to urgent care, because then you run the risk of getting more people sick. So what we need people to do, if you think that you're sick, if you think that you've contracted the coronavirus, you can access your provider through the telephone. It's called telemedicine. So you can either, if you have a primary care already, you can contact your own primary care. And if not, we've created a list of resources where you can get telehealth or telemedicine appointments on your phone. And you don't have to leave the house. So we have multiple different offices that have telemedicine available that will serve anybody in their community, regardless of their immigration status. And so that's accessible through our website. Once you have access that information, if they think that you need to come in for testing, they will let you know. and then you will be tested. But we know that there's a lot of similarities between this virus and the flu and allergies and just a normal hay fever. So we just want to make sure that people that maybe just think they have the flu don't come to an office where there might be somebody who had the virus, because then now you might get sick, even more sick. And we want to prevent that. So if you think that you're ill, you need to just stay home and call your medical provider. And if they think you need to come in for testing, that can be arranged.
Okay, I'm just going to say that in Spanish really quickly because I think that that's such a huge point right now. Porque sienten que están enfermos de cualquier cosa, incluyendo el coronavirus, que ahorita es mejor hablar a un centro médico para explicar los síntomas que tiene o describir lo que le están sintiendo para no entrar a un hospital ahorita porque la situación está un poquito más... pueden contraer el coronavirus, es posible en un hospital. Entonces queremos evitar eso, queremos evitar el contagio del coronavirus de tanto como de parte de ustedes a otros, como de otros a ustedes. Entonces, si tienen algún problema médico, llamen primero a una clínica y ya después ellos los instruyen con qué deberían de hacer. Si es necesario que entren a un hospital, ellos les van a decir. Y si no, los pueden atender por medio del teléfono.
Si estás indocumentado y necesita accesar un clínico comunitario, nosotros tenemos información sobre los clínicos comunitarios que ofrecen servicios a la gente indocumentada o también a gente que no tiene aseguranza en este tiempo, porque cada persona tiene que tener precaución en este tiempo y tiene el derecho para estar saludable.
Y toda esta información, Asambleísta Torres, se puede encontrar en ayudanevada.com.
Sí, claro, toda la información está disponible en ayudanevada.com y también si no puede encontrar la información que necesita, solamente tiene que poner algo en la caja para charlar.
¿Cuál es? ¿Qué ponen en la caja?
Es a chat box. Sí, y allá en el chat box solamente tiene que poner su nombre, su número telefónico y la pregunta que tiene, y nosotros podemos estar en contacto con la persona que tiene la pregunta.
Ok, así que está bilingüe, la ayuda es bilingüe y se puede hacer por internet, también les pueden mandar por teléfono en ayudanevada.com.
Sí, claro.
That's great. I see that on this page, they also have a little bit of information about the CARES Act, which is federal help. How has the CARES Act influenced the coronavirus response? What has it provided for the people of Nevada?
So we know that the CARES Act is going to get money into the Nevada system. It's going to give us more access for us having funding for community health clinics. It's give us more money into Nevadans that are currently receiving unemployment. Additionally, I think there's been a lot of information for people about the $1,200, the checks. And I think like something really important to clarify is the CARES Act passed, and everybody who pays taxes and is, I believe there has to be an American citizen or a legal permanent resident making less than $75,000, and they have to be on time with their taxes, then they're going to get a check for $1,200. That's not going to be every single person. So it's important to know that. Additionally, you're not going to have to provide any information to get money from the CARES Act. So you're not going to have to call or fill out a new application or call with your credit card number. We really want to prevent fraud in our community. And so that means that if somebody calls you and says, can you give me your social security number in order to receive the CARES tax, you need to say no. And if you have questions, you can contact us or contact the congressional offices, and we'll help you with that. But nobody should be reaching out to you and telling you that they'll get you your check faster, or that if you fill this out, you're going to get your check. So just so that people are clear, the check is going to come the same way that you get your taxes. So if you get your tax money through direct deposit, it's going to come through direct deposit. But if you get your tax money through check in the mail, then it'll come through the mail.
That's so important to note that no one is calling people at their homes directly to talk about this what people are calling the coronavirus check at all. They're not going to ask you for a social security number. They're not going to ask you for any of your personal information. In fact, no one is making these rounds at all. So if you get those calls, that information, you should report it if you can.
Yeah, and you can report it directly to us, and we'll put you in touch with the Attorney General's office to report that. Additionally, we've seen a lot of fraud with people just saying like they have a cure for the coronavirus, or maybe you don't have to get a recommendation from a doctor to get testing. Just pay us the $60 and we'll give you testing on the spot. If it's not coming from a doctor, don't get the test. It's not going to be an accurate test. And right now, there is no test for somebody to come into your house and test to see if your house has the coronavirus. It's not in existence right now. So if somebody is coming to your door for any reason, offering those services, or if you see them on social media pages, know that they're probably fraud. And if you have questions about that, you can reach out to us so that you don't, you and your family are not victims of fraud during this scary time for our country.
Yeah, and it sounds like there's a lot of opportunity right now for people to prey on the fears that the community has, right? So one of the big fears has been, I don't know whether I have it or not. We've seen that nationwide, not just in Nevada, there are not enough tests for everybody at this moment. So, and there's no secret way to get those testings unless it's through a medical provider. So again, like we reiterate, do not spend your money on a test that, is dubious and fraudulent. And any other information, people that are seeking your information, do not provide any additional information to them because we don't have capacity right now. There are no government systems reaching out and asking people for this type of information. So know that it could be people preying on the fears that Nevadans and people nationwide are all experiencing together right now. And so it's really the fear of unknown, the economic fears, the fears for their own health and safety. And I know that a lot of elected officials and people who are in positions of power right now are working to alleviate those fears. So thank you, Assemblywoman Torres, for participating in that and making sure that we're working as hard as possible and as fast as possible to combat this coronavirus so that we can quell anxiety that people have and hopefully move into our normal routines as quickly as possible. We've seen a lot that now that we're in a larger economic shutdown, schools have been closed as well. How quickly did schools get closed in Nevada?
In Nevada, schools closed pretty early on here in Nevada. So they've been closed, I believe it's been 3 weeks now. So we closed on, I think it was the 19th that we closed. So we're approaching the end of the 3rd week.
And we see that in ayudanevada.com, they have so many resources, so we can't stop just saying that you should really go check it out. There's some resources also for homeschooling for parents and teachers as well. What can you share with us about what in terms of education right now? Because that's one of the most important things for Latino households is making sure that their children are educated.
Right now is a really hard time as far as like education, distance learning, and what that looks like in the household. And we have to understand that like education at school is going to look different now that we're bringing it to home. And that's okay. I think that our students are still going to learn a lot of valuable things from the time that they're spending at home. And really, we know that teachers and school districts are going to have to work hard to continue to make up for this gap in the years to come. And that's okay. But there's some things that we can do at home to make sure that our kids have access to that quality education while they're at home. 1, check your school district website. Most school districts have put out guidelines of what your kids should be doing at home. So check your school district website. 2, read at home. Every kid should be reading. If you have a kindergarten or a pre-K, like pre-K through 3, maybe you're reading to them. But once your student knows how to read, you might have them read to you. And once they've hit like 4th grade, 5th grade, maybe they're reading by themselves. And they should be, every student from grade 4 to 12th grade should be reading by themselves at least half an hour a day. And it doesn't matter really what they're reading. I always tell my students, I'm an English teacher, and so I work a lot with literacy in my classroom. And I always tell them, it doesn't matter what you're reading. It doesn't matter if it's a magazine or if it's a comic book. or if it's a newspaper, they should just be reading and absorbing information. And then maybe ask them what they were reading about. They're like easy things that you can do at home to make sure they have literacy, or have them write about what they were reading about. That's like the best way to practice. But additionally, like there's other resources from your school districts that should be made available to you. If you have textbooks at home, you can ask your student, what was the last thing you learned, and just kind of move forward from there. Don't be scared to do things differently than the ways teachers did. It's completely acceptable that maybe your student is learning how to do multiplication one way, but you might not know it. This might be a new way for them to teach multiplication, and it's not how you're used to doing it, and that's fine. Teach your student your way. It's only going to give the students more diversity in how they can use mathematical principles and science principles. If you have a kid at home, you should be making them have some type of schedule as well. That's going to really help them kind of get into the routine of things. So 15 minutes outside, maybe every day they're up by 9 or up by 8 o'clock. They're ready to learn from 9 to 11. You have lunch at 11 o'clock. That routine, that pattern is really helpful for a lot of our kids. So try not to break it. No, you might not have science class every day because maybe that's not your specialty. I know it's not mine, but you can still provide them academic opportunities. Maybe you're watching a documentary as a family. I know Disney Plus actually has some great nature ones. So don't be scared to change what the classroom looks like in your own home.
And that's right. We have a lot of online tools available, or maybe more than we realize, that we can utilize and bring into our homes right now. And I think that that's something that we can really appreciate, is that when this pandemic hit, a lot of people made different resources available online, often for free, that we can tap into. So that's a great point. And I love what you said about establishing a routine. And I think that that also helps with anxieties that people may have, because this is, a very drastic and sudden change that wasn't expected. But having that normal routine in home life can help support children, especially with the different changes that are involved at this time.
And trying to find some ways to get some physical activity in is really important too for our students' social emotional development. Especially right now, I know that kids are equally stressed. My niece is having a hard time being away from everybody and being home all the time. But having time outside, I know, has been positive for her to kind of just like deal with the stress of like not being able to leave your house and really not knowing why everybody's home. And so I think, it's really important that you keep your kids physically active, find different ways, find things they like, whether it's dancing or just spending time outside. If you have a backyard, which is something a lot of us here in Vegas have the luxury of having, but just, trying to find whatever it is that you can do to kind of settle and kind of reflect on your day and where the week is going.
That's great. Assemblywoman Torres, what other recommendations would you have for Nevadans at large for what to do for how to confront coronavirus? Right.
I think that, there's a few things. So one, stay home. We don't need to all go to the store to pick up our groceries, and one person to go to the store. If you need to go to work, take the necessary precautions, wear a facial covering, wear gloves when you go to the store, wash your hands frequently. When you get home, shower, just get everything off of you, wash your clothes. Those are just some necessary things because we don't have all the information about how the virus is spread. So it's just easier to just get rid of your clothes, put on new clothes, because you don't know where that virus might be. Another recommendation that we have is, just keep your immunity up. So just eating healthily, making sure you're having vegetables, keeping your mental health, taking care of your mental health is really important. Call people, don't go out with them. I know we've been seeing a lot of like Zoom outings, and that's great. If you need to engage with your friends, Zoom them. But don't go over to their houses. Obviously here in Nevada, all of our non-essential businesses have been closed. Don't try to find ways around that. Just let them be closed. I know Netflix has like a watch party on it now, so you can have a Netflix watch party with your friends. But find ways to engage with people without leaving your home.
that's right. Here in LA, actually, it's mandatory for us to wear face masks now.
Mhm.
We leave our homes, and they did that to help protect us from spreading the virus, like both ways, because we don't know who has it and who doesn't. They just decided to make it mandatory for everyone. I'm looking around to see where I have them, and just want to bring them out to like familiarize people, because especially for our Latino communities, we're not used to wearing face masks at
Oh, we're
all.
not used to social distancing.
It's like so new, and I know that like we're in my household, like really the face mask is a thing that no one wants to do, but they're doing that because they understand like that we're in a different situation right now, and that it's really useful to everyone. So I just wanted to bring them out. I don't have anything special. It's just a regular bandana that I got at a baseball game one time. So I just roll it up and just put it on. And this is enough for us to go out to the store right now, like for our mandatory face mask usage. This is enough. I can wrap it up however I want. But for now, this is essentially what's getting us by. And following the recommendations of our leaders is so important now. And so listening to them and having these types of broadcasts. So if you need to tune into the governor's updates when he has them, tune into those as well. Is there any other place where people can find regular information or updates on changes that are being made in their counties or localities or states?
Yeah, so I mean, here in Nevada, we actually have, the governor created a website that has information specific to Nevada about what's going on. It's nvhealthresponse.nv.gov. The website just has the press releases that are going out here in the state of Nevada. Any governor directives are out and available pretty immediately as soon as the governor makes a speech or he issues them. So the website has been a phenomenal resource for community members of just accessing information. I also think our local news has been doing a phenomenal job of keeping the community up to date. I'm really fond of the Nevada Independent, and they've done a really great job making sure that like information is easily accessible to our communities. I really applaud the community for making sure that we have that information accessible. And then our website will continue to post information as soon as we get it. And we're trying to be proactive in getting information about governor's directives and anything that's new that might hit by presenting it in graphics or some more accessible form.
So great. We have a lot of on our plates right now. I know that everyone is doing their best to stay at home, and it's more helpful than people realize for our healthcare systems, because this isn't just about us not getting sick. It's also about, well, it is about that primarily, but in addition to that, we're helping to keep open our hospitals and clinics to relieve the strain right now, or prevent an influx of people from having to use the hospitals at the same time, because if everyone gets sick together, that overwhelms the hospital systems. And so that's what we're trying to prevent. Nevada has been doing a great job at slowing the spread, and for people staying at home, they're helping a lot. Is there anything else that people can do right now to help? Or do you think that this is the primary undertaking that they need?
And I really think that the primary thing is that people are staying home. You know, it's not a good opportunity. This is not like the best time for us to be leaving the house for almost any reason. So just stay at home. Here in Nevada, they actually have encouraged us to get outdoors, but make sure you're maintaining social distancing and only aggregating with people that live in our households if we are going outside. So if I'm going to the park, it's not going to be to have a big soccer game with all my friends. I'm going to the park and I'm going to take a stroll with the people that live in my house. And that's it. You know, it's not a time for us to go and form big parties. I know us Latinos, we like to have a barbecue. It's good weather right now, so it's really hard. But if you're going to have that barbecue, only do it with the people that live at your house. So that's really the best recommendation. Additionally, you know, I encourage people to wear gloves, wear face coverings. Anytime that you're leaving your house, we're going to be at a store or in the public, just to prevent you from contracting the virus, or you might be spreading it. You might have the virus and not even know it. And so this is just a way for you to take care of your neighbor and to take care of yourself.
Yeah, and right now we are approaching Easter. I know that that's a huge, it's a huge celebration for Latinos, and we're seeing that church services are moving online. We have been asked not to do the Easter dinners at our homes with our families, unless they're people who live in our homes on a regular basis. And also asked not to, like you said, no, don't go to the park and celebrate. Do everything online. Is there this week? We've also been told that it's a critical week for people to stay at home. So for anyone celebrating Easter, there are a lot of ways that you can do it online. And I know that Nevada churches and places of worship are accommodating for that as well.
Yeah, we've definitely seen the religious community kind of step it up to make sure that services are available for everybody of multiple religions here in Nevada during this time, because a lot of people, I think too, with the additional panic, we want to be close to our church or religious community. And there is ways to do that virtually, and I really appreciate all the work that our communities have done throughout Las Vegas and throughout the state to make sure that there are services available online. And I know that recently that there was members of the Jewish community, they put together the box for Passover, like all the different things that you need to have to celebrate Passover. They put it in a box, and they were actually giving them out to people and delivering them. Because they know that this is an important holiday, but usually you would go to somebody's home to celebrate Passover. And so this is an opportunity for you to celebrate differently. And so they were making sure people had what they needed so they could celebrate. So I could really see our religious community has stepped it up, doing whatever it takes to make sure our community stays home. But we have to do our part too. And that means that, Easter dinner is going to be different this year. Spring break has been very different this year. But that means we're doing our part to keep our neighbors healthy and to keep ourselves healthy.
So we're seeing a lot of people coming together, from those who are coordinating the food banks to, people who are regulating, overseeing housing, shelters as well, our clinics, our frontline workers, our healthcare providers, and a lot of other people who we may not know right now, like our truck drivers are really working hard to make sure that we have everything that we need. There's a lot of coming together at this time, and I feel like that brings a lot of peace to us who we want to do more maybe, but we know that right now the best thing to do is to stay home. There's a lot of comfort in knowing that there are so many agencies and so many people working together, like yourself, Assemblywoman. Thank you so much for putting in all of this work and coordinating all of these things behind the scenes as we stay home. What's your outlook? What do you foresee for all of these different sectors as we move forward with the coronavirus? I keep wanting to say it in Spanish.
I think that the last 3 weeks and the next few weeks are going to be difficult for our community. But I know that we're battle born and we're Nevada strong. And we're going to continue to collaborate and work together to make until our community bounces back. And it's going to hit us hard. We are expecting budget cuts. The governor shared that information a couple of days ago here in Nevada, because we do rely so heavily on the tourism industry. However, I know that together we can all make a difference. We can help one another. We can lean on one another. And we need to do whatever it takes to keep our community healthy and to continue to keep our community safe. And sometimes that means that the next few weeks are going to be hard. However, we're really fortunate that we have so many organizations collaborating, public sector and private sector working together so that we can create initiatives that are really going to keep Nevada safe.
Yeah, and I really want to thank everyone at Moms in the Air Force and Comadres. You guys have been leaders on this, and I know that coronavirus is something that you're undertaking as well, because pollution plays a huge role right now in how which communities are impacted and how harshly they're impacted as well, because our lungs our lungs are impacted by pollution, which makes people more susceptible to having more complications if they were to contract coronavirus. So I know that Moms Clean Air Force and Ecomadres are tackling this very, very hard because they understand the risks that our communities are in, especially Latinos, communities of color, who tend to live in areas that are most polluted. as well. So taking the proper precautions, listening to what the state and local ordinances are will be really crucial right now as we try to contain the virus, its spread, and the risk of death within our communities. Selena, is there anything, Assemblywoman Torres, that you would like to say before we sign off?
No, thank you to everything that Moms Clean Air Force is doing to continue to stay home and keep our communities safe. And, outside of this, thank you for everything you're doing to keep our environment safe for ourselves and for our kids and the people that come after us. So I really appreciate all the work that you're doing. And stay at home, quédense en la casa.
And thank you so much once again for providing us a list of resources for anyone who needs more resources in Nevada. Ayudanevada.com is where you can be going. Again, it's ayudanevada.com. A lot of resources, and we have people like Assemblywoman Torres who are working hard 9 days, even if it's from their homes right now, to make sure that we all get through this together. So thank you so much, Assemblywoman Torres.
Thank you.